serve.
And
It's okay, Bernie,
just telling
Bernie.
her 4:30 this morning, my husband came in and woke me up because he went out and he pooped and he sat in it and he was covered. His whole back. was a
Just got
mess.
this on so we don't have any accidents with the teeth. Good boy.
Anyhow, I brought him in, it was a week ago yesterday. And were you running him up and down the hallway?
Mm-hmm.
Okay. She knows what he was doing.
It was
He was
limping.
collapsing.
Well, no, he was, his left hind leg was just going out from under him and he was falling down.
Okay.
And we didn't know why. We thought it was a heart, a lung, a nerve issue. You know, we didn't even think of pain.
Right.
And so I can show you where he hurts right now, if you come here. Now he starts to tense if I get near it.
He's gonna howl.
He might, I don't know.
They never do it in here.
But it was over in this area. He got really, really upset with me.
Good.
You know, but I don't want to push down and hurt him, so because I don't know how to examine
I'll
him.
let her
But,
do that.
yeah.
Right, exactly. Okay, Bernie. So does he usually bite or just because he's painful
No,
now?
it's pain.
Right, okay.
No,
Yeah, he
he's
bites when he's in pain. You know,
usually a lover.
when I accidentally found the spot, I was petting him, and he went,
Right.
and he jerked his head around like he wanted to bite me.
Right.
So, and I know that's not normal Bernie
Right.
behavior.
And he is due to be groomed this Thursday, which I don't think is gonna happen.
Yeah, I know. You gotta make sure he's doing okay. Come take it.
You know, we're worried there might be some kind of hip issue or.
Right. We didn't do x-rays a week ago.
They did heart and lung x-rays.
Yeah, they did chest. But we're
back
not
there.
sure if it's a
It's
spine
really
or a hip.
painful, yeah. Not painful, but tense. See how just by me
Yeah.
touching he already
Yeah,
twitching.
you get the right spot and I'm sure you'll... I just very gently rolled him over when I was brushing him yesterday and he let out a yip.
Bernie, it's gonna be okay somehow. But he was laying
What kind
on.
of medication is he on? I'm sorry. You can finish. Just tell me. He was laying.
He was laying on his right side with the left
I
side
don't
up.
know what it is.
Oh, that's it. But that's the one I put him on.
Okay.
That's the only thing he's taking right now?
Yeah.
Okay.
And I got shorted on it too.
That's all right.
I need to get more because
Stand up, Bernie. Stand up.
He doesn't want to.
Good. Doesn't seem to see his things. Doesn't seem to be his abdomen. It seems to be more the back, really, the dorsal area, the spine. Which is better, I suppose, than to be an organ problem.
It's okay, Bernie.
he says, I don't think it's okay.
Right.
Well, he was laying on his right side with his left side up when I found the spot, and he reacted to it. So maybe if you lay him
But do you
down.
think that's the only spot? Yeah? Phew, I hate when they do that. He always thinks an emergency.
See, right at first we thought it was his front leg giving out because he's had surgery on it and he's been kind of
Right.
gimpy.
Lay down on
Good.
your side. Then I'll teach you in here. Good boy, Bernie. Don't worry. I'm not going to hurt you for no reason. I'm just trying to feel around.
Checking the hip.
Yeah.
I'm feeling for hip
A little
dysplasia.
hint. Yeah. I cannot feel for the hip dysplasia itself, but I can feel for instability, and mainly I want to see if he's going to show painful response to it.
See, you got my mouth clamped shut.
But you can scream, Bernie. I actually think he kind of has a good range of motion here. I think it's more, see the spine,
Yeah.
I think the back in here, it's what's really killing him. He's like, not there. That really
Because when I
hurts.
touched him, it was right around.
Here, but
Here.
sometimes the thing is when they have back pain, it irradiates, you know.
Yeah, that's what I was thinking too.
Okay, I'm glad at least the pain meds worked, so maybe I just have to add another pain med, maybe some anti-inflammatories too. The only reason I didn't, legs towards that way now. The only reason I didn't put him on anti-inflammatories before is because they can be a little rough on their stomach, and I want to make sure.
Yeah, and plus with him not wanting to eat right now, you know.
He's lost a pound
Right.
since he was here before.
But sometimes if he's not eating because of pain, we gotta really sometimes take a risk and put him in the anti-inflammatory because maybe he's not gonna eat until he feels good. You know what I mean?
Because I'm sure that all this does is just it zonks him out, but it doesn't really solve the problem.
Is this an opiate
Right.
by any chance?
Is that what? Yes, it is.
Yeah. I was zonked out of morphine a
It's
couple
okay.
months ago.
It's okay,
Had major
Bernie.
surgery.
It's okay, Bernie.
Sometimes, yeah, I see.
Yeah, his whole foot's shaking here.
Oh, Bernie.
Your back hurts, son, sweetie. But the one that was going under him, it wasn't the right, it was the left
It
before,
was
right?
left.
So it could be a spine issue.
Right now, I think where he cries the most is when I'm touching here. But the X-ray, I would let you an X-ray, shows
Yeah.
this area too.
Okay.
So we will know.
Yeah.
Okay, Bernie, let me listen to your heart now. At least when I feel his abdomen, it doesn't seem to be too painful in there. So,
Can we undo him now?
in a second, I just want to listen to his heart. And then, yes, we can. My baby.
I feel
Oh,
like
I'm sorry. Was there a phone left in here by a client?
No, no phone.
Okay, sorry.
We know he has a murmur in his heart.
I'm sorry?
We know he
murmur?
has a murmur. We know about that, so that's not new.
Oh, yeah, definitely.
Look out for it.
It's okay, Bernie, Bernie. Good boy. You're a good boy.
Okay. But he has no signs of heart problems as coughing or
Nope.
getting tired easily? No? Okay, Bernie, you're fine, baby. Let's do some x-ray and we go from there, okay?
We'll also do a chemistry. Repeat the blood work that we did last time to see what
Is that all the injections and everything?
So, there, what is the issue?
Yeah.
she doesn't know yet.
So, what are the shots for?
Probably an infection, since his blood count was really high last time.
And
So we want to
it's-
repeat it because it's still really high. She wants to make sure the organ functions are still normal, because last time they were normal, but she wants to see if this time maybe they've changed.
Yeah, because he came in and asked if his spleen had been removed.
Because there's something suspicious in the x-rays, but we just know it's suspicious. We don't know nothing further. And I'll go over that with you right now too, so I can get the straight story, because right now she's bouncing back and forth from the two rooms.
So that includes all the injections, the
Yes.
medications.
For now, yes. And then after she sees the blood work, if she wants to supplement something else, I'll let you know first, but I think that's it. Okay.
And I need the balance of this stuff. Is he going to be taking this along with
Huh?
this? Is he going to be taking this along with whatever?
Yes. Yes. And then I owe you, right? Remind me if I don't get it to you.
2.4.
Come on, Bernie, we can go this way. The blood work's gonna take like 15 minutes.
Now,
or
is that
so.
the total of everything, or is that on top of what you already showed me?
Total of everything.
Okay.
Okay.
Get some more
Come on,
blood
Bernie.
tests.
You wanna walk this way?
Come on, bud. He
He's
said,
like,
"You're
I
not
don't want
pulling it
to.
out twice."
Some more blood. More blood. Oh, he said, rub my tummy.
Bad part is, we gotta bring you back if we do it for the next 5 days.
Maybe. I wish they would tell us why.
Huh?
I wish they would tell us why, but they're taking so long. It's been like hours. We've been sitting here doing nothing. Waiting. I'm sorry, I'm just frustrated that we're spending all this time with no answers. You good boy, Bernie. Yeah, you good boy. You're tired of this too, aren't you? Yeah, we're tired of this too.
It stinks.
Well, as soon as we got him out of the carrier, he pooped. What do you
No, I
expect?
know, but what's coming out of it stinks.
Well, hopefully it's beef and not blood like they're saying.
No, it could be blood.
I know, and that scares me. That's why I want them to get in here and tell us what is wrong. But they're farting around and it's making me mad.
No, not. They're doing tests and it takes time to do the tests.
I know, but I wish somebody would come in here and say, oh, we're doing this test, it'll be another 5 minutes. Sorry, it's just all the waiting and the not knowing, and they say scary things. It's getting my mind going, and you know how I am. You know how my mind is. I'm freaking out. I'm screaming silently. Nobody can hear me. I just want to know why my dog is sick. That's all I want to know. I just want an answer. I'm sure you do too, Bernie. Yeah, you just want an answer. Oh, good boy. Oh, good boy. Yeah, he's a good boy. We're here because we love you.
Want you to feel better. Is the doctor going to come in and talk to us again?
I'm sorry?
Is the doctor going to come in and talk to us again?
Probably.
Yeah,
Yes.
'cause I want to know
You have
what's going
questions
on.
for her?
Well, he
Yeah.
came in and asked me if his spleen had been removed.
Oh, because just to see if there was something that matches with the x-ray. But yeah, we're going to go over that with you for sure.
Okay.
We're not going to just send you home with medication and not explain it.
So, is that liquid medicine?
Yes, miss. Now be ready.
Hopefully they'll have some answers, Bernie. Yeah. Oh, good boy, yeah. You're one handsome dog, Bernie, even when you're a mess.
My nose is cold.
Okay, I'm back. I'm sorry. I know you guys been here forever. It's just like,
Yeah, freaking out.
it's okay. He's fine. I mean, at least he's here with you guys. Okay, his back looks fine. It doesn't mean he doesn't have, bone-wise, it looks fine. I don't see any disc that pulled out of place or anything like that. He's really tense in here, and actually what he does have is his liver or his spleen, possibly his spleen, seems to be a little enlarged. I cannot by the x-ray tell which one it is that is enlarged. But what I did is I took a quick pic with the ultrasound, and there's no big old pocket. It doesn't look like a big spleen tumor. When they do have spleen tumors, they have big blood pockets inside, and if that rupture, they can bleed out to death.
Yeah.
But
Yeah.
I didn't see any big blood pocket in there. So I am just recommending a regular ultrasound later on when Dr. Wyatt comes back, because I don't do ultrasounds in here. Me, Dr. Rossi. I know how to take a peek, but I'm not good to, to charge you for a full ultrasound and do a full thorough job. I just don't have enough practice, let's say. The white blood cell count, which is the neutrophils, they are like the defense cells of the body, it's very high. When Dr. Wyatt saw him a week ago, it was just a tiny bit high. Today, it's very, very elevated. Much more than it was last week.
Okay.
I would like to give him a little sub-Q too, if I could.
Okay.
Sub-Qs. Today is way, way more elevated. Normal is 17,000. Last week, I think it was 20,000, which is a little bit higher. So Dr. White gave him an antibiotic shot that lasts for 2 weeks. Today, from 20,000, he went up to 60,000.
Wow.
Oh, gosh.
So I am suspecting he may have an infection somewhere. It could be on the liver or spleen that looks a little bigger, but that's why I repeated his chemistries too, which is organ function. And his liver markers still look absolutely normal. So that's good.
So the white cells are just up, so his body is fighting something.
An infection probably, yes.
And what about the poop? Was that blood or is that the beef or?
It's a little bit of blood in the poop, yes.
Okay.
But what we do when they have blood in the poop, we give them some anti-diarrhea medication and we give them antibiotics. So I'll give him antibiotics too, and that will hopefully make him feel better.
Okay. Now, what's the shot every day for?
Antibiotics.
Okay.
But I'm giving him 2 antibiotics.
Okay.
Okay? Because I don't know what's going on in his liver or his spleen. So I'm just giving him a broad spectrum antibiotic. I know you guys cannot give them pills, so that's fine. I'm sending liquid home, and then I'm doing the other one under the skin once a day.
Yeah, he is a master at, I mean, you'll look at his mouth and he'll pretend like he swallowed it, and 3 or 4 hours later I'll find it spit out on the floor somewhere.
Yeah,
Right.
he's too smart.
He's just
Correct.
too smart
For his own good, right now.
And that's using a pill popper thing, getting it way back in his throat, and he still gets it back out.
So I'll give him a little anti-inflammatory for his back. We can refill the pain meds. I'm giving him 2 antibiotics, and I'm giving him anti-diarrhea medication.
Okay.
It's a bunch of stuff, but it's all liquid, and 1 is a shot. Let's see how he does, and we will recheck. Well, every day when you come for the shots, I'll touch base with you and see how he's doing.
Okay.
And then Dr. White will be back on Wednesday, so he can have his ultrasound on Wednesday if that's the case. Okay?
And how much does an ultrasound cost?
I don't know. I can have Gina give you the cost
Yeah,
for it.
because it's starting to get, we're on a fixed income.
I know, and I'm sorry. Some problems are just like,
He's
$100 problem, easy to fix, and some problems are just like,
You might have to
Baby.
pay in installments or something.
well, if that's the case, I'm pretty sure we can try to work out something with you guys. We never ever will let him die and suffer just because of money,
Yeah.
We'll work out something, okay?
He's our
We
baby.
just need him to get better, exactly.
Yeah. You know, he had a half-brother that we were supposed to get a hairless Chinese.
I know.
He was kind of deformed
Yeah.
looking dog.
Yeah,
On
he
the
was
outside.
deformed on the outside. Well, it turns out he was very deformed as soon as he went off his mother's milk. It was the day before we were supposed to get him, he died.
Oh, wow.
And they, what do you call it?
Necropsy?
Necropsy on him. His blood system was not connected to his liver.
Oh.
And as soon as
That's
he went
why.
off mother's milk and went on food,
He
it
had
was
a
like
shunt,
poison.
probably. Yeah. I think, a shunt. The blood doesn't go through the liver as it's supposed to go.
Yeah.
And
Yeah.
it's doing it for him because his liver's normal, and that would probably, if something was wrong, it would have gotten him as a puppy, or it would have shown up on this test just now, right?
Oh,
I want you to
well,
show her what he does.